your implant journey is going to cost you more in terms of money, education, equipment, and time than what you originally think. Guarantee you that now. Hi everybody, and thank you for joining me on my very first podcast. I am really excited. This is, let's hope that I get enough engagement, and I'm looking forward to discussing all thing implants with you. I'm very excited. So just a word of warning, when I get excited, there's lots of things that go through my mind when I start thinking. I do have a tendency to stutter, so please bear with me. If I'm trying to express myself in one way and I start stuttering, it's because I'm trying to think of several things in one go. I'll try not to do that, but it will be an inevitability at some point. So quite a few of you already have liked my Instagram page, liked my Facebook page, and I really appreciate it. I hope that I can impart just some of the knowledge that I've been finding over the years with regards to implant dentistry. Now, this podcast, it's aimed at, there's going to be stuff for beginners, there's going to be stuff for people of intermediate level, there's going to be stuff for people who are expert level. I'm not professing to be an expert in absolutely everything, but what I'm saying is there's loads of things that I know that we can open doors for discussion, and that's what I'm hoping to do, to get people thinking, to raise the bar and really push forward with implant dentistry, pushing forward the science and pushing forward the patient care as well. Now, where are we going to start today? Well, I'll probably start by telling you I've already got 4 or 5 guests lined up, ready to discuss some absolutely fantastic stuff. So I've got Riaz Yar, who's very kindly agreed to come on so that we can brainstorm all things with regards to occlusion and implants. So that's obviously going to be a great one to look out for. I have spoken to Farhan Ahmed, who's very happy to come on and discuss how to get into implants, how to progress your career, how to find the right mentor, and things along those lines. So it's who else we've got? I've got Kevin Rose, who's happy to come on to discuss how do you communicate with patients without bamboozling them? Because what you don't want to do is, when you're talking about implants to patients, you don't want to talk about screwing in titanium into their jawbone. Patients don't want to hear that. So Kevin's really great with his communication style. So we'll be speaking to him at some point, and I'm speaking to several other people as well. And it's going to be really exciting. I've got Stavros, who's a good friend of mine, and he will be happy to come on and discuss. For those who've seen Stavros's cases, the man is superb. His grafting skills are second to none. So I know he uses a lot of PRF and things along those lines. So we're opening the door to so many discussions. So I'm really excited, really looking forward to it. If you have any questions, feel free to ask at any point. So let's get started with today's episode. I thought, what better thing to start with than, the 7 deadly sins of implant dentistry, because I've fallen for these myself and it's caused some grief. So I just wanted to impart some wisdom. I don't know if I'm that old, but I wanted to impart some pearls. And hopefully that those who are early on in their implant career or considering starting in implantology, or those that are kind of like at an intermediate level, that they're wanting to know, where do I go from here? What do I do? That they don't fall into the same mistakes that I did. So the first item I think that we should discuss, the first deadly sin, is only doing one course. Is a lot of people think, fantastic, I'm going to get into implants, it's going to be great, I'll do a year-long course, I'll be able to do everything. Nah, that's what everybody thinks, but that's not what happens. So you need to understand it's a career progression with implants. So you need to understand when you're getting into it that just like when you got into dentistry and by the time you qualified after 5 years, and this is what a lot of consultants and professors probably said to you when you're at university as well, is once you qualify, that's your license to start learning. That's not the end of your training, that's the beginning of your training. And there are lots of great introductory courses out there. And you can go, one day a month for a year just to build up the basics. These courses have got slightly different structures. They will open the door to get you in so that you can start with kind of like the simplistic cases under mentorship. And it's a great way to start because quite often these courses they're done on weekends, so it's less time out from practice, things along those lines. But you need to understand it's the start of your implant career. It's not that, I'm going to do this and all of a sudden I can do everything. So don't be disheartened. If you want to get into it, absolutely get into it, but you have to get into it dedicated with full passion and understand it's going to take you a long time to learn this stuff and it's going to require a big investment as well. I'm still learning. There is loads of stuff I'm still learning at the moment. It's just an absolute pleasure. But when I first started, I thought, after this year-long course, I thought I'd be able to do 80% of everything that comes my way. And that wasn't quite the case. And if you think like that, then you're not really going to get full benefit out of it. So go into it thinking to yourself, actually, you know what? This is going to be the start of my career. The second deadly sin is not having a mentor. And you don't just need one mentor, you need several mentors. And this is absolutely critical. This is so critically important. I can't even begin to express, I am beginning to express how important this is. Why is that? It's because you want to gain knowledge from people who have made the mistakes, who can say to you, actually, don't quite do it this way, modify it. If you do this, you're going to get a slightly better outcome. And you need somebody where if you're starting a procedure and you're getting into hot water, that somebody can back you up. And that's really important. And your mentors will grow into friends over time. And, a good mentor will genuinely be thrilled about seeing your progression. I know that my mentors are, and the people that I mentor, it's just watching them progress and get better and better and better. It's absolutely fantastic. So as you're getting into implant dentistry, or once you're even into implant dentistry, once you're starting to think about the next step, you need to start thinking to yourself, who do I want to mentor me for this? Who do I get on well with? Who's my mate who does this all the time that I can pick their brains on? So it's really important that you get the right mentor. And so when you're looking at courses, also look at how you're going to get a mentor as well. Okay? Let's move on to the third deadly sin now, I think. This is a big one. And the reason why I say it's big is because if you do a course and you start placing implants, or you're already placing implants, you do a course to progress your skills, that if you're not doing enough of that work, you're not going to gain the muscle memory, you're not going to gain the experience to really become proficient at it and become comfortable with it as well. So you also need to look at the demographics in your area. Are my patients amenable to having this type of work done? Do they have the means to fund it? Can I work part-time in another practice where I can do this type of work? So all of these things start to come into play. And the reason why I stress that this is so important is because when you first start with any procedure, is you read about it, you do the course, and you think, great, I can do this. And as you know, courses are designed so that it's a little bit easier for you. It doesn't matter if you're working on a cadaver. It doesn't matter if you're working on a model. The model's not going to complain. And the only way to start doing things along these lines is, let's say, for example, you go on a sinus lift course. Well, if you're doing 1 or 2 sinus lifts per year, you're not really going to gain the muscle memory. So the question then becomes is, well, which route do you take? Can you find a way to start to develop more of this within your practice, or maybe work part-time in another practice? Or are you going to think to yourself, well, actually not, I'm not going to go down the sinus root work. What I'm going to do is I'm going to do the other stuff and I'll refer the sinus work out. There's no harm in that at all. It's, you're doing yourself a favor and you're doing your patients a favor. If you're working in sinuses 3, 4, 5 times a week, then yeah, very quickly you start to understand, this is how it works, this is what we need to do. Oh, damn, this has gone wrong, this is how we fix it. Things along those lines. So, and it's the same with any level of implant work, really. So if you go on a course and you're ready to start placing implants, and I remember this well when I was first trained by Richard Brookshaw. One thing Rich said to me is, Pav, he said, be really careful, really careful. He said that you've got to start placing a bigger volume of implants quite quickly. Otherwise, your confidence is just going to drop like a stone. And he said you have to start getting wet-fingered with it. So as well as looking at your courses, also look at, how am I going to start to implement this? Have I got enough patients? Have I got 20 patients waiting to have this done already? Can I go to my mentor's place? Is my mentor prepared to let me do this with him or things along those lines? It's definitely something to think about. It really is important to get the adequate experience. And if we think about it, that's true with any aspect of dentistry. So if you're starting to get into orthodontics, you go on an ortho course and you're doing 2 cases per year, your confidence isn't really going to build. If you're doing an orthodontic course and you're doing 5, 6, 7, however many cases per month, then you start to build up the muscle memory. So you need to have this all in your plan, how you're going to execute all of this. Okay. Deadly sin number 4. Yes, this is quite an interesting one. Failing to invest in adequate equipment and education, okay? Your implant journey is going to cost you more in terms of money, education, equipment, and time than what you originally think. Guarantee you that now. Did with me. As I said, when I first started, I was like, yeah, year-long course, I'll be able to do 80% of the work, the other 20% of the work I'll start to refer out. And you just develop this burning passion for it. It's just awesome. When you start to get these fantastic results for patients, it really is fantastic. But then what you start to realize, well, hang on, what I've learned, I'm limited. I can only do this, this, and this. I can't do the rest of it. And then as your skills start to progress, then what you end up doing is you end up looking and thinking to yourself, okay, well, I'll do this course, find a mentor for this. And all of a sudden your skill level starts to swell, it starts to grow. And that will continually happen up to a point that you're happy and comfortable with. So, everybody has their own comfort level. And if your comfort level is doing single implants in the posterior region out of the smile line in a healed ridge, you're probably going to have less stress than somebody like me that pushes the boundaries a little bit. So you need to understand going in, it's dependent on your comfort level, what you want to be able to achieve. It will also be dependent on your lifestyle, and there's lots of factors that come into play. But understand that normally when you get into it, people are like, I want to know more, and it really is a fantastic field. I'm just trying to make you aware that whether you've just considering getting into implant dentistry, or you're already in implant dentistry, or when you progress your career, it's never ending. It's never ending. It's at the moment I'm studying a lot. I'm being trained for zygomatic implants, things along those lines, and I'm having to study hard. Finding the right mentors and finding the cases. It all still applies to me. And, so that level of commitment to implant dentistry has to be there. But you can cut it off anytime that you want. And as I said, it's, if you're happy doing simpler cases, fantastic, because you will be busy enough. Okay? Yes. Now, this is a good one. Deadly sin number 5. Trying to execute complex treatment before you're comfortable with the basics, or using one technique for everything. Guilty. Yes, I have done that. As I said, I've gone on courses and thought to myself, yeah, I can do this. And you jump in and you start your treatment and you very quickly learn, I can't do this, I should have got a mentor. Or, I'm in way over my head and your results are very limited. your skills will progress the more that you do this type of work. But you need to understand as well is if you've been taught in one form of grafting, you need to learn other techniques in grafting to tackle all the different cases that come your way. Because what works in one scenario is not going to work in another scenario. It depends on so many different factors. I'm a big fan of autogenous bone. I like the Kuru technique. I like the IDR technique. I do use synthetics. I do use allografts. I do use PRF, blood plasmas, things along those lines. I occasionally use Xeno. I use different types of membranes. Sometimes I don't use membranes. Sometimes I glue in membranes. Sometimes I'll have zirconia membranes made. You know what? It depends on the clinical situation and what you're trying to achieve. So this is what I'm saying to you is that, is when you start, you can't just have one set of skills. You have to expand your skills so that you can serve your patients better. Not only serve your patients better, but it is going to be much more beneficial to you, much more professionally satisfactory to you in order to have a wide range of set of skills. And then another reason why that's important, because sometimes you try A, it doesn't work, and you've got to switch and do Z. Sometimes you've planned for point 1, and halfway through the procedure, something doesn't go quite right, so you've got to take a tangent to get to point number 2. And the only way that you can do that is having a great wide range of skills. If the only thing that you can do is simple GBR and you're trying to do very complex grafting, what happens when it doesn't work or you can't get things stable? Then what? So this is one of those things. I'm a great believer in. And there are so many great different techniques out there for all sorts of different aspects of implant dentistry. Just continue learning, textbooks, online, there's great online sources, there's courses, there's just so many different ways that you can learn. Pick the brains of your mentor, you've got studies to read, you've got, articles to critically appraise. There is so much that you can learn, but continue to learn. It is vitally, vitally important, okay? Deadly sin number 6. This is quite an obvious one. Don't listen to everything the implant companies tell you, okay? They're trying to sell you something, no? It is up to you. It is your responsibility to take the data that's provided and critically appraise it so that you know what's the science and what's the crap. Because you can forget the crap, and you really need to understand whatever it is that you're getting into. That and don't get me wrong. Okay, I'm not bashing implant companies because they will give you a significant amount of support. They'll give you lots of data. What I'm saying is, whatever data they get you, just critically appraise it so you know the actual science behind it. Because then you can have enriching conversations with your reps and your implant companies. You turn around and say to them, "I read this paper. I've got this question." And quite often they will go back and they will bring an answer for you to answer your question. Sometimes they won't have an answer for you, and that's fine as well, because it might be that the science hasn't progressed that far. But you need to understand, as I said, you have to critically appraise everything that you do. Even textbooks, read it and think, what's the current data? What are we supposed to be doing? Is this correct? Is this how it should be doing? What's the quality of this data? Are there any errors in it? What type of conclusions have they made? Is the conclusion actually this, but they've stretched and extrapolated to that? And if they have extrapolated the data, is it valid data? Because sometimes it can be and other times it can't be. So you need to understand how to critically appraise a paper. And this is one thing that I learned when I did my MClin Dent in implantology, was how to critically appraise a paper. Because when you start reading papers and articles, you start going through them and you start to apply critical appraisal tools, the vast majority of stuff that's out there is a load of nonsense. It really is a load of crap. But that doesn't mean you can't gain something for it. It just means that you have to understand how valuable that source is. And then you get other papers where you're just reading it and you just go, this is like, honestly, it can be like pornography. It's just like, it's so good. It makes you feel so good because the study is designed so well. And you can't just read stuff and take it at face value. There's a great level of satisfaction that comes from applying critical appraisal tools and finding a really good paper, because then you're just like, this is quality work. This we can apply directly to clinical practice. Okay, where are we up to now? Deadly sin number 7 already. Okay, this is a big one. This is the one that's going to catch virtually everybody out. This is the one that catches me out all the time. Not appreciating the patient's biology. Yeah, happens a lot. The more I study, the more I'm actually surprised that implants actually work at all. Purely and simply from a point of view, there are so many factors involved in healing and long-term maintenance of the implants. Like, you sat there going to yourself, how are these not just rejected all the time, just like left, right, and center? How is it that despite all of these, that our success rates are actually what they are, which is pretty good? And the reason why this is important is because not if, when failures happen, okay? I'm a great believer, anybody who turns around and says they have 0 failures, they are either lying or they place 2 implants a year, because it's easy to have a 100% success rate when you place 2 implants a year, okay? When failures happen to you, you need to be able to go back, or even, I'll tell you what's even better is planning forward, understanding the nuances. And it's not just, perio, smoking, uncontrolled diabetes. There is so much more above and beyond that. What else impacts? Vitamin D, high cholesterol, thyroid, omeprazole use, SSRI, so antidepressants, stress effects, implant healing, lack of sleep. What else have we got? We've got diet. Can you see where I'm going with this? It's just endless. So sometimes it's, you may be looking at a medical history of a patient, and you need to understand what it is that the patients are showing there, because it might be a little bit of this and added with a little bit of that, and a bit more. It sounds like Mambo number 5, doesn't it? A little bit of this, a little bit of that, and add it all together. It starts to increase the risk of complications for the patient. And it's great to have a conversation with that patient about that beforehand, because then they own the problem. It's not your problem. It's the patient's problem, and they need to understand that going in. So it's really important as well, where I first started is I got distracted, as you might have seen. It's not only pre-planning, but when things do go wrong, that you don't beat yourself up about it. And sometimes and I've had this as well, is patients fill out the medical history and you go through it, you do the treatment, it's not successful for X, Y, Z reason, and you probe the patient a bit more. Are you sure you haven't got this? Are you sure you haven't got that? Are you sure? Oh yeah, well, I've been on antidepressants for 3 years. And you just think to yourself, that's why we do the medical history. Why couldn't you disclose that beforehand? This is what I'm saying is it gets you thinking so that you can start to really have these enriching conversations with patients beforehand. So if you know what they do for a living, and you can start to probe them a little bit. Just say, tell me a little bit more about your lifestyle. How stressed is it? How much sleep are you getting? Things along those lines. Are you managing to look after yourself? Are you managing to exercise? Have you ever felt depressed, being put on antidepressants because of this type of stuff? It's one of those things that we can do everything technically that we want to, and we may do it to a technically perfect standard. But then it's over to the patient's biology, and we don't have a vast amount of control over that. And even if the implants integrate successfully at this end, then we're still trying to get it to last as long as what we possibly can. Now, if we're trying to make things last as long as what we possibly can, let's say 2 years down the line, the patient goes through a divorce, they go through bankruptcy, they lose one of their parents, and they lose their home as well. That's a lot of stress. So what happens in those cases is you may have treatment that's successful, and all of a sudden their biology's changed, and that change in their internal biology, it may actually trigger some sort of problem with the implants or other issues. So it's understanding that, we are absolutely at the mercy of the patient's biology. When you understand that, you can have a conversation with the patients with regards to that. The patient starts to take more ownership of their own problems. And it's not a case of, well, you know, doc, you said that this implant was going to be all right for 15 years. And the reason why I say this is because I've got a couple of patients at the moment where they're like, Pav, you said that this implant was going to be fine for 20 years. And I was just like, I really shouldn't have said that. It's like 11 years in. And they're like, yeah, but you said 20 years. So we've got, and a lot of that was back when, you know, implant companies were turning around saying, oh yeah, you know, a 95% success rate over a 20-year period, 25-year period. And that's just not the case at all. You have to treat each patient individually. You have to do a risk assessment. I'm a great believer in doing risk assessment, and look at their risk profile and then discuss it with the patient. And turn around and say to the patient, like, you know, if you're not prepared to take this risk, don't have the treatment done. So, you know, it is really, really important. So, you know, it is critically important that both we as clinicians and the patients understand that we are dealing with their biology. Okay, so I just wanted to recap really briefly. I don't know how long I've been rambling on for. It's, you know, however long it is. It might have ended up being a 10-minute podcast. Might have ended up being a half-hour podcast. I just enjoyed it. I've been rambling on. Okay, but let me just summarize a little bit for you. So, sin number 1, we discussed about doing one course and thinking that that's it, it's all over and done with. It's not going to happen, okay? You need to understand going in that you're going to want to learn more and more. It's the start of your implant journey, and it's a fantastic journey, okay? But just be prepared for continuing education, okay? Sin number 2, not having a good mentors. Multiple, okay? It's you can have a number of mentors for different things. You know, there are people skilled in different aspects. Your mentor might not even be in the UK. You know, there's no harm in brainstorming with mentors via email and things along those lines. For example, you know, one of my mentors is Howie Gluckman in South Africa. And, you know, seeing surgery done by Zana Fall, her work is just incredible. And, you know, I'm constantly pricking her brains. What do you think about this? What do you think about that? And she's just like, yeah, you know, it all makes sense. So yeah, get the right mentor. Make sure you're exposed to enough experience. This can be really tricky. I don't know your practice demographics. Your demographics may be good, they may not be quite so good. You may be really exposed at one thing, you may really be underexposed at another, and that's fine. That's not a problem. You know, is if you're finding, you know, you're not doing full arches, but actually what you are doing is you're doing a couple of implants for denture stabilization for little old ladies, and you're doing them day in and day out. Fantastic. You know, there's no harm in that at all. What that means is you're going to become better at me than that in no time at all, because I don't do a lot of that type of stuff. I struggle with it, with the denture stabilizations, because most of my patients want fixed teeth. Yeah, deadly sin number 4, as I said, failing to invest in enough equipment and education. You gotta keep thinking, I need to invest, I need to expand my skills, I want to invest more in a mentor. Get comfortable with it. You have to, absolutely. Okay. Deadly sin number 5, as I said, is just thinking one technique will let you do everything. Or doing a course and not getting a mentor and then thinking, I'm going to have a crack at that. Yeah, absolutely. And then getting your fingers burnt. I've had my fingers burnt plenty. It's caused me more than enough headache. Please don't do it yourself. The complex stuff that I'm doing now, I'm doing it under mentorship. And I'm getting better at it. And you know, it's that's the whole point of a mentor. So yeah, that's definitely a very important one. Sin number 6, do your own research, critically appraise anything that comes across your way. And rule number 7 is, you know, is understand the patient's biology so that the patient takes responsibility and that you don't take it to heart when things go when things don't go quite according to plan. So I just thought it would be fun to share some of the things that I thought have burnt my fingers over the years, because as I said, I've succumbed to all of these, every single one. So I want to help you guys avoid the mistakes that I made during my progression. So it's been fantastic. I'm sorry I've rambled. I hope it makes some sort of sense. I do have a habit of getting waylaid and backtracking and circling back to things, and I do apologize about that. I hope I didn't stutter too much. But I've had fun, and I think this is going to be great. You know, some of the guests that I've got lined up, some of the topics that I want to discuss. It's just going to be a great opening doors for discussions. Just to give you a little bit of an indication, some of the things that I've got down here: using PRF, restorative protocols, restorative materials, connection types, force distributions. Medication use, sinus work, grafting, what to learn, who to learn from, things like, it's just, I've got a big list already, and I'm looking back to your feedback saying, Pav, can we discuss this? Pav, can we discuss this? Absolutely, not a problem at all. I would be absolutely thrilled to, because I'm hoping to learn as much as I can from you guys as well. So please do leave some comments and get in touch. And I will hopefully have the next podcast up in around a week or so. So I'm hoping to send these up about once a week. And a big thanks to Jazz Gulati, who said to me, Pav, you know what? I'm doing a podcast. I'm getting quite a lot of traction on it. He said, you've got a lot of knowledge. I highly recommend that you do a one based around implants as well. So he's been offering me advice, and thank you very much. And I will speak to you guys soon. Bye.